Assalamualaikum warahmatullahi wabarakatuh to our lecturer, Madam Jamhirah binti Abdullah. Today we will presenting about the National Mental Health Policy 1988 revised in 2012. We are from AM 238 4D and we are from Group 5. Before we get started, let me introduce our group member. My name is Nur Amirah Dasha binti Muhammad Azizi, and here we have Nur Amirah binti Muhammad Kamilan, Aminur Ain binti Khairul Anwar, Fatin Nur Afrika binti Arifin, and Nadira binti Nur Azmi.
Assalamualaikum to Madam Jamhirah and our fellow classmates. My name is Aminur Ain, and today I would like to present about the introduction to the National Mental Health Policy and also policy problems. According to the World Health Organization or WHO in 2014, 1 in 4 people worldwide is affected by mental or neurological disorder at some point in their lives. Around 450 million people are currently suffering from these conditions, making mental disorders one of the leading causes of ill health and disability globally. Due to the increasing concern regarding mental health issues, this National Mental Health Policy was introduced to improve mental health services, awareness, and support systems. This policy focuses on several main strategies, including enhancing governance and the regulatory framework, strengthening mental health surveillance systems, ensuring the availability and accessibility of quality mental health services, strengthening mental health resources, as well as encouraging collaboration between different sectors and communities. Overall, this policy plays an important role in promoting better mental health care and improving the well-being of society. First, let me introduce you to the first policy problem. Firstly, rising mental health among youth. From 1988 until today, mental health issues among youth and students have increased significantly. In the late 1980s and 1990s, mental health was not openly discussed because many people viewed it as a sensitive topic. Students who experienced stress or depression often kept their feelings to themselves and rarely sought professional help. As time progressed into the 2000s, academic competition became more intense. Students had to manage heavy workloads, examinations, financial problems, and social expectations. At the same time, the development of technology and social media created additional pressure. Many young people began comparing themselves with others online, which negatively affected their self-esteem, confidence, and emotional well-being. From 2010 until the present day, mental health issues among youth have become more serious. The COVID-19 pandemic further increased stress, anxiety, and depression due to online learning, social isolation, and uncertainty about the future. Although awareness about mental health has improved compared to 1988, many students today still struggle to access proper support and cope with emotional challenges. Secondly, stigma surrounding mental health. Since 1988 until the present day, stigma surrounding mental health has remained a major issue in society. In the late 1980s and 1990s, mental health problems were often misunderstood and considered a taboo topic. Individuals with mental illness were sometimes viewed negatively, causing many people to feel embarrassed or isolated. As society developed, awareness about mental health slowly improved, but stigma still continued. Many individuals, especially youth and students, became afraid of being judged, discriminated against, or labeled as weak if they shared their struggles or sought professional help. Because of this fear, many people chose to suffer silently instead of getting support. Today, despite campaigns and educational programs about mental health, stigma still exists in schools, workplaces, and communities. This situation prevents early treatment and emotional support, which may worsen mental health conditions over time. Therefore, society must continue promoting awareness, acceptance, and open discussions about mental health. And last but not least, limited access to mental health services. From 1988 until today, limited access to mental health services has remained one of the major challenges in addressing mental health issues. In the late 1980s and 1990s, mental health facilities and professional support services were still very limited. There were not enough trained professionals such as psychiatrists, psychologists, and counselors to meet the needs of the public. As the number of mental health cases increased over the years, the demand for professional support also became higher. However, many public healthcare institutions still face shortage of mental health specialists. In addition, people living in rural and remote areas experience difficulties accessing treatment because mental health facilities were mainly concentrated in urban areas. Today, despite improvements in healthcare systems, access to mental health services is still limited for many communities. Long waiting times, expensive treatment costs, and lack of awareness about available services continue to discourage individuals from seeking proper care. As a result, many people do not receive early treatment or emotional support, which may worsen their mental health conditions over time.
Now, I will talk about the objective and the strategy under the National Mental Health Policy. That mental health is an important part of overall well-being because it affects how individuals think, feel, and behave in their daily life. Therefore, this policy aims to improve the awareness, access to service, and also reduce the stigma related to the mental health in society. The first objective of National Mental Health Policy is to promote the mental health awareness and education among the public. This objective focuses on raising awareness about the importance of mental health well-being by reducing stigma and providing essential resources and also support for mental health. By addressing misconceptions, providing accurate information, and fostering supportive environment, individuals will be more encouraged to seek help and maintain the good health. One of the strategies used in this digital mental health campaign and social media outreach, social media platform has a strong potential in spreading verified public health information because the content can be more related, engaging, and emotionally connected with the audience. These platforms support the patient education, public health campaign, and behavior change intervention. Social media also provide a scalable and interactive way to spread the health information to the largest audience effectively. Another strategy is the school-based mental health education programs. This program aims to promote a well-being by reducing stigma related to the mental disorder and encourage help-seeking behavior among the students. Schools are important environment because they provide opportunity to promote emotionally well-being, prevent mental health problems, and identify students who may need support. Training package and mental health program can help the teacher, counselor, nurses, and also the school administrator better support student mental health needs in school setting. Now, let's move to the second objective, is to improve the access to quality mental health service. Mental health services are important because they help in the prevention and treatment of the mental disorder while maintaining the resorting of mental health of the population. Improving service quality require proper assessment and measurement so that the weaknesses in the mental health system can be identified and improved over time. One strategy is the strengthening mental health service through the multi-sectoral collaboration, which means government should establish or strengthen national committee for student and adolescents mental health to coordinate planning and implementation. At the local level, mental health subcommittee should also be strengthened to improve the awareness, also resource allocation and implementation plans with communities. Another strategy is providing the telemental health and crisis hotline service. This service can help the individual to access support more conveniently, especially those who living in the rural area or individuals who are afraid to attend physically consultation. Digital technology such as telemental health service, mobile application, and online peer support group can help reach underserved population and provide easier access to mental health support. And the last objective is to reduce the stigma and discrimination related to the mental health. Many individuals with mental health issues will face a negative stereotype, prejudice, and discrimination from society. This can lead to labeling, social exclusion, and fear of seeking professional help. In some cases, stigma may also cause individuals to internalize negative perspective and develop self-stigma, which can further affect their emotional well-being. One strategy to reduce this stigma is by collaboration with the stakeholder, which means policymaker, healthcare provider, patient, carrier, and community should work together to improve understanding and awareness about their mental health. Research and awareness programs involving both urban and rural community are important to ensure mental health policy and support system are suitable for all groups in society. Another strategy in workplace mental health support initiative. Organization can create a supportive working environment by offering counseling service, mental health leave, and awareness.
My name is Amira binti Muhammad Kamilan, and I will be presenting a policy evaluation focusing on mental health policy. Policy evaluation is a process of assessing how effective policy in achieving its goal help us understand what works well and what area needs to improve. In this presentation, I will discuss about the strength, and my friend Nadira will be discuss about weakness of the policy. One of the key strengths is the effort to reduce stigma and discrimination. Before the policy, mental health was often seen as a taboo topic. Many people were afraid of being judged. They were not willing to seek professional help. However, we look at the right box. After the policy was implemented, there is clear improvement. There is now a greater collaboration between government, school, NGO, and healthcare providers. More mental health advocacy programs and awareness campaigns are also conducted in the school, workplace, and on online platforms. In addition, safe place has been created, allowing people to openly discuss their mental health. As a result, public understanding, acceptance have been improved, and stigma has been reduced. And look at the bottom box. Is another strength is a mental health awareness and education. There was a low awareness, and many people misunderstanding about health disorders such as depression and anxiety. Education on this topic was also limited. Now, mental health education has increased in the school, university, and communities. More programs such as workshop, counseling session, and online campaign are being carried out. This help improve public awareness and encourage people to talk more openly about mental health. Finally, the policy also improved access to mental health services. Before this, most services are focused on psychiatric hospital and urban area, making it difficult for people in rural area to get treatment. After the policy, mental health care facilities have expanded nationwide. Services are now available at the primary health care center, community and community center like Mentari has been established. There are also more psychiatric service available in hospital and clinic, which is improved to access a quality care. In conclusion, policy is strong because it reduces stigma, increase awareness, and improve access to mental health service. These changes have created more supportive and understanding society.
Hello, madam. My name is binti. I will explain about the weaknesses of the National Mental Health Policy. For the weaknesses, the National Mental Health Policy still faces challenges in reducing stigma and discrimination related to mental health. Before the policy was implemented, stigma toward mental illness was already strong in Malaysian society. Many individuals with mental health problems were negatively labeled, discrimination against, and socially excluded. At that time, public understanding about mental health was still very limited, causing many people to avoid seeking professional treatment because they were afraid of being judged by society. After the policy implementation, the government introduced more awareness campaign and educational programs in schools, universities, workplaces, and communities. These efforts slightly improve public understanding regarding mental health issues. However, stigma and discrimination still remain major problem today. Many individuals still avoid treatment due to fear of judgment, especially in workplace, schools, and public settings. This shows that although the policy has helped increase awareness, the objective of fully reducing stigma and discrimination has not yet been completely achieved. Another major weaknesses of the National Mental Health Policy is the shortage of mental health professionals and resources. Before the policy implementation, Malaysia already faced shortage of psychiatrists, counselors, and clinical psychologists. This situation limited the effectiveness of mental health care service because the number of trained professionals was not enough to support the growing number of patients. As a result, public access to proper treatment and counseling service was resisted. After the policy was implemented, the government introduced more mental health programs and expanded healthcare facilities to strengthen mental health services. Efforts were also made to improve service delivery and increase support system for patients. However, the number of mental health professionals is still insufficient compared to the increasing public demand today. Reports show that Malaysian psychiatrists to population ratio remains below the recommendation of the World Health Organization or WHO. In addition, limited funding and workforce shortage continue to cause long waiting times and reduce the quality and efficiency of treatment services. This situation shows that the strategy of strengthening mental health services still face major challenges, especially in terms of workforce. The third weakness is inconsistent collaboration between stakeholders in supporting mental health initiatives. Before the policy implementation, cooperation between schools, NGOs, healthcare providers, and government agencies regarding mental health support was still limited. Mental health programs were not widely coordinated, and support systems differ depending on the institution or location. After the policy was introduced, more partnership and collaboration were established to support mental health awareness and services. Some schools, universities, and workplaces actively conduct mental health programs and awareness activities. However, the effectiveness of this collaboration still differs across regions and institutions. While some organizations provide support system, others still lack awareness program, trained personnel, and proper mental health initiative. This situation shows that the policy strategy of collaboration with stakeholders has not yet been implemented equally and consistently throughout the country. The next weaknesses of the National Mental Health Policy is unequal access to mental health services, especially in rural and undeserved areas. Before the policy existed, mental health services in Malaysia were mainly concentrated in urban hospitals and large cities. This caused rural communities to face difficulties accessing treatment and counseling services because there were very limited facilities available outside urban areas. Many people living in rural regions also need to travel long distance to receive proper mental health care treatment. After the implementation of the policy, the government expanded mental health facilities and introduced more services to improve accessibility. Community mental health program and additional healthcare services was introduced to help more individuals receive treatment. However, despite this improvement, access to mental health services still remain uneven between urban and rural areas. Urban areas continue to have better facilities, specialists, and healthcare support compared to rural regions. Rural communities still face shortage of mental health facilities and trained professionals. Transportation problem and limited healthcare infrastructure also make treatment difficult to access for many individuals. Therefore, these witnesses show that the policy objective of improving equal access to quality mental health care services has not yet been fully achieved nationwide. That's all from me. Next, I will pass to the next person.
Now, I will present about policy recommendations for national mental health policy. The first recommendation is strengthen anti-stigma campaign through continuous education. According to the current ETL 2012, continuous mental health education can improve public understanding and reduce discriminations toward individuals with mental health problems. In addition, re-ETL 2012-2013 found that school-based mental health program can improve emotional resilience, academic performance, and help-seeking behavior among young people. This is because early education is important because it encourages people to seek for professional help before their condition become more serious. Therefore, the government should continue mental health education program instead of relying only on short-term awareness campaign. Mental health literacy should be included in school, workplace, and community programs. Collaboration with educator, healthcare provider, religious leader, and media organization is also important to help normalize discussion about mental health and reduce stigma in society. The second recommendation is improvement in terms of research and legislation framework. According to Nurul Amirah Hamzah and Noraini Uthman 2024, the government need to improve mental health data collection in Malaysia. Data collection should involve different ministries, while the Ministry of Health should manage and coordinate the data. As a start, the government can combine existing mental health data from different registries as suggested in the National Health Performance Report 2016. These efforts can help researchers conduct more studies related to mental health and improve future policy making. As for the legislation's aspect, it is suggested to repeal Section 309 of the Penal Code. Criminalizing suicides does not give a positive effect to the individual facing mental health problem. So, according to the World Health Organization, criminalization may discourage people from seeking treatment because they are afraid of punishment or legal action. So this can be seen in some countries such as Hong Kong and England, where criminalizing suicide has also been linked to increased suicide rate. Therefore, supportive treatments and mental health care are more effective than punishment. The third recommendation is increased investment in mental health infrastructure and workforce. According to Sazina ETL 2007, shortage of mental health professionals reduce the quality and accessibility of mental health services. Therefore, the government should expand mental health facilities such as psychiatric units, rehabilitation centers, crisis intervention services, and digital mental health support system. In addition, Nurul Amirah Hamzah and Noraini Uthman 2024 state that there are still very limited positions for clinical psychologists in government hospitals. Therefore, the Ministry of Health should create more positions for clinical psychologists, establish separate requirement pathway, and set up dedicated clinical psychology department in government hospital. This These structured efforts can improve the accessibility and quality of mental health services in Malaysia. In conclusion, the National Mental Health Policy has played an important role in improving mental health awareness, promoting public understanding, and strengthening mental health services in Malaysia. Through various strategies and initiatives, the policy has contributed to creating a more supportive environment for individuals facing mental health issues. Therefore, continuous commitment and cooperation from the government, healthcare institutions, and society are important to ensure better mental health support and well-being for the community. That's all from us. Thank you for watching and listening to our presentation video. You can scan the QR code for the references. Thank you.